Hello, hello, hello. So guys, thank you for showing so much support, and I am Dr. Abhishek. Welcome back to my channel Side Dental Vlogs. और thank you for showing so much immense support to my channel, and I hope you liked my previous videos, and many people have commented to make a video in English. That's why I am making a video in English for you people. And if you are coming for the first time to this channel, I am Dr. Abhishek, working as reader in Department of Oral Medicine and Radiology in Bhubaneswar Institute of Dental Sciences. So many people had inquired about the diagnosis and treatment protocol of complete diagnosis and treatment protocol, but I cannot give you entire things, treatment protocol and entire things. I cannot give you the diagnosis. So basic patient which comes to your clinic, I can give a hint, or I can lead to some I can lead you people to some conclusion to what will be the treatment plan for the particular patient. So what I have seen in my clinical practice and with the students, that many people are confused about the diagnosis of caries, whether it's a pulpal lesion or a periapical lesion. पल्पाइटिस है या पेरियापिकल पैथोसिस है, अपाइकल पेरियोडोंटाइटिस है, रिवर्सिबल पल्पाइटिस है या इरिवर्सिबल पल्पाइटिस है, whether it's an abscess or it's a granuloma. So there is a lot of confusion between the diagnosis and treatment. So first of all, when I'm giving just telling one example, suppose you take an X-ray of any patient, and is it always necessary that how you diagnose the case? Suppose you take a carious tooth X-ray and you see that the radiolucency which is there surrounding the enamel dentin, and it has approximated the pulp. So what do you suggest to the patient? To do a root canal treatment, right? It cannot be done by restoration. But sometimes you may also see a carious lesion which has already involved the enamel and some part of dentin but not the pulp. So in that case also root canal is required or not? So in those cases you need your clinical expertise, and you should remember one thing, that in order to be radiographically visible, the tooth structure has to be 30% demineralized, then only it can be seen in the radiograph. That means, in a simpler way, if the caries is even not involving the pulp, even if it is in the dentin, it may require a root canal treatment. मतलब सिंपल भाषा में, अगर रेडियोल्यूसेंसी इनामल डेंटिन और पल्प तक एक्सटेंड नहीं करता है, कभी कभी ऐसा भी हो सकता है कि उन केसेस में भी आपको रूट कैनाल करना पड़े. क्लिनिकली इट इज गॉन इनटू द पल्प बट नॉट रेडियोलॉजिकली. So in these kind of cases we need to recognize, and in some interior places you don't have facility for a good radiograph, the current will go. So in those cases you need to diagnose clinically. And so what are the symptoms? So first of all, we'll talk about directly on the point on reversible pulpitis. Second one is the chronic irreversible pulpitis. Third is the apical periodontitis. So these three things are the main things which we daily encounter in our clinical practice. So what is this? First of all, reversible and irreversible. So what are the symptoms of reversible pulpitis? Any stimuli, whether hot or cold. So if the stimuli is there will be a reaction of the pulp, there will be a pulpal hyperemia, and there will be inflammation of the pulp. So patient will have momentary sensation only for 5 to 10 seconds. जैसे कि for example you are eating ice cream and you are biting, and then suddenly you are having a sensation, and then it reverts back to normal. That is reversible pulpitis. Okay, there need not need any caries, caries lesion, big caries lesion to make a diagnosis of reversible. Even an attreated tooth can be a reversible pulpitis or a irreversible pulpitis or a apical periodontitis. So reversible pulpitis is very easy to diagnose, and second one is the chronic irreversible pulpitis. In what is the main symptom of chronic irreversible pulpitis? First of all, the patient will not be able to locate the exact tooth where the pain is coming from. He will be saying some pain is there in this left or right side region, and I'm not able to recognize the tooth. Patient will tell you. So, and the symptom, what else he will tell? Pain increases during the night time. Okay, while lying down, because of the flow of blood increases while lying down. So there will be a lot of pain when the patient goes into a supine position. Third is whenever the patient will eat any food or cold or any hot food items, there will be stimulus, right? Stimulus, so the pain will increase, but it will not decrease as soon as the reversible pulpitis. The pain will decrease only after taking medications. So these kind of cases need a root canal treatment. So now we go to the so you know there is a radicular pulp and the coronal pulp. Coronal pulp means the infection is there in the coronal pulp and the radicular pulp. So what is acute pulpitis? So whenever suppose you are drilling a cavity and the cavity is very much deep and by mistake you punctured the floor of the cavity and you entered in the pulp canal. At the time there will be a severe sharp sensation of pain. So immediately your pulp fibers inside the coronal pulp chamber will be inflamed, and that is acute pulpitis. Or whether the chemical leaches of the restoration, the phosphoric acid will leach into the floor of the cavity. At that time also you will have a acute pulpitis, severe pain. Now if the patient is able to locate the tooth, suppose any carious tooth is there and you are percussing on the tooth. Percussing means hitting with the mouth mirror from the back, not like a hammer but a slight percussion. So you should never ask the patient ki pain ho raha hai or his pain is there. So you have to, the patient will give a bodily jerk or he will close his eyes or he will move away from you. So that tooth is a apical periodontitis tooth. So you have to percuss on the tooth and patient will be able to tell you the tooth where it is paining. So that means there is a case of apical periodontitis. If the pain is severe, it is acute apical periodontitis. If the pain is long standing, it is chronic apical periodontitis. It eventually turns into a granuloma or a abscess. So I hope थोड़ा बहुत आपको पसंद आया होगा ये और थोड़ा बहुत समझ में आया होगा, और मैं ये वीडियो ज्यादा लंबा नहीं बनाना चाहता हूँ क्योंकि कंफ्यूज हो जाएगा आपको. अब पेशेंट इसमें अपाइकल पेरियोडोंटिटिस में टूथ को ऐसे लोकेट कर पाता है और पल्पाइटिस इरिवर्सिबल पल्पाइटिस में क्यों नहीं कर पाता है? Because of the power of proprioception of the human mind, there are 8 delta fibers inside your tooth periodontal ligament with which patient is able to know, okay, that is the pain is there due to the A delta fiber, the proprioception, the property of proprioception. That means if you are walking, you are moving your right leg, then again you are moving your left leg, then again you are moving your right leg. You are not moving right. You are moving right, left. That is the way you are walking. That is proprioception and kinesthetic sense. Similarly, the tooth is having proprioceptive fibers in the periodontal ligament. So that's why patient is able to locate the tooth. Similarly, in the pulpitis case, there are C fibers that will conduct the pain and in the form of sensitivity. So this is the main diagnosis: reversible, irreversible and apical periodontitis. I hope you like the video. थोड़ा सा आपको कुछ समझ में आया होगा, नहीं समझ में आया कमेंट करिए, दोबारा वीडियो बनाऊंगा. And till then, take care. Please do comment what kind of videos do you want: educational videos, motivational videos and clinic videos. I make videos on dental products also. Right now I am not making because I am not using any new product. So soon those kind of videos will also come. And till then, do subscribe to my channel. Take care. Goodbye.